Welcome back to another veterinary health topic. Today we are going to briefly discuss upper respiratory infections in cats. Please remember to subscribe to our channel for more informative videos.
A respiratory tract infection is an infectious disease that can affect the nose, sinuses, and throat, or lungs. Upper respiratory tract infections are much like the common cold in humans. The upper respiratory infections are highly contagious among cats and have the potential to progress down the respiratory tract, all the way to the lungs and develop into a far more serious lower respiratory infection such as pneumonia. The upper respiratory tract infections in cats are also referred to as feline infectious respiratory disease or feline upper respiratory disease complex. This condition is caused by a variety of viruses and bacteria. The typical clinical signs of upper respiratory infections include fever, nasal discharge, sneezing, runny eyes, cough, drooling, and loss of appetite. There are numerous organisms that cause upper respiratory infection in cats. The three most common organisms are the feline herpes virus, also called the rhinoraschitis virus, Chlamydophila felis, a bacteria, and Mycoplasma, a type of bacteria. The diagnosis of upper respiratory infection can often be made on the basis of history and clinical signs. Further diagnosis can be done on the secretions to identify the organisms causing disease. PCR panels can also be helpful in identifying the causative agent of the disease. If the upper respiratory infection does occur, then antibiotics are often prescribed to help fight the disease. Doxycycline is a common antibiotic that is prescribed. Azithromycin might be used instead of doxycycline. Treatment is aimed at managing the clinical signs. Most cases of upper respiratory infections are caused by viruses, which means the antibiotics are not going to resolve the problem. In most instances, your veterinarian will provide treatment for you to do at home. But in cases where cats won't eat or drinking or have serious breathing difficulties, hospitalization may be required. Intravenous fluids may be given to prevent dehydration, and oxygen therapy can be used if necessary. Please contact your local veterinarian if you suspect your cat is suffering from an upper respiratory infection. Subscribe to the veterinary channel for more informative videos.